So hello guys, first of all welcome all of you to my new channel Learn with Ease. So guys, in the last lecture we had started a very important topic from the abdomen and pelvis, that is urinary bladder. In the last lecture we had learned about the structure of urinary bladder, external features of urinary bladder and relations. So guys, today in this lecture we are going to learn about the interior of urinary bladder, capacity of urinary bladder, arterial supply, venous supply, lymphatic drainage, nerve supply and the clinical. So guys, first of all we will go through the diagram and then we will go through the notes. So guys, first of all we will see about the interior of urinary bladder. The interior of urinary bladder can be examined by a procedure known as cytoscopy, which is done during the operation or the procedure of autopsy. So guys, if we done the cytoscopy, then we can clearly see the interior of urinary bladder is thrown into numerous folds, and these folds these are produced due to the loose attachment of the muscular cord. Here you can clearly see here you can clearly see that the interior of urinary bladder, it is thrown into numerous folds, and these numerous folds these are produced as a result of loose attachment of the muscular cord. But at the lower triangular area, this triangular area, here you can clearly see that at this triangular area these muscular folds were absent, and this lower triangular area, it is called as trigone of urinary bladder. This is the trigone of urinary bladder. Here you can see that the muscular folds these are absent at the trigone of urinary bladder. As the name suggests, the trigone of urinary bladder, it is triangular in shape, and it has apex and the base. The apex of trigone, it is directed downwards and forwards, while the base is formed by the uh, base is called as interureteric ridge or the bar of Mercier, and this interureteric ridge or the bar of Mercier, it is formed as the result of the continuation of longitudinal muscle cords of the two ureters. Here you can clearly see these are the openings of the ureters, and the interureteric ridge or the bar of Mercier, it is produced as the result of continuation of the longitudinal muscle cords of the ureter. And here is the apex is directed downwards and forwards. Just behind the apex, here you can clearly see the elevation is produced, and this elevation, it is called as uvula vesicae. And this uvula vesicae, it is produced due to the median lobe of the prostate. This is the uvula vesicae. And if we can see the openings of ureters, these openings of ureter, these are 2.5 centimeter apart in an empty urinary bladder. If we consider an empty urinary bladder, then the distance between these two ureteric openings will be 2.5 centimeter, while in a filled urinary bladder the distance between these two ureteric openings will be the 5 centimeter. And these are the superolateral angles. While while if we look at the capacity of urinary bladder, the general capacity of urinary bladder varies from the 220 ml to the 500 ml, but the ideal or the mean capacity of urinary bladder, it is 220 ml, varying from the 120 to 320 ml. As the bladder gets filled up to the 220 or uh, more than 250 ml, there is a desire to micturate. But if the bladder fills more than the 500 ml, then there will be the painful urination or painful voiding of the urine. Now we will go through the notes. The interior of urinary bladder, it can be examined by a procedure known as cytoscopy, or which is done during the operation or at autopsy. The empty urinary bladder, in the greater part of mucosa, show the irregular folds which are produced due to its loose attachment to the muscular cord, and in the lower triangular area mucosa is smooth, and these irregular mucosal folds these are absent in the lower triangular area due to its firm attachment to the muscular cord. And this triangular area, it is nothing but the trigone of urinary bladder. In the trigone, the apex is directed downwards and forwards, while the internal urethral orifice is located at this apex. The ureters opens at the superolateral angle of the bladder, And these urethral openings, these are 2.5 centimeter apart when the bladder is empty, and these are 5 centimeter apart when the bladder is filled or distended. A slight elevation on the trigone immediately posterior to the urethral orifice, it is called as uvula vesicae, and it is produced due to the median lobe of prostate. The base of the trigone, it is also called as interureteric ridge or the bar of Mercier, which is produced due to the continuation of longitudinal muscle cords of the two ureters. Capacity. Capacity of urinary bladder. The mean capacity of urinary bladder in adult male, it is 220 ml, which may vary from 120 to 320 ml. Filling of the urinary bladder beyond 220 ml causes a desire to micturate, while the filling up to the 500 ml may be tolerated, but beyond it, it will be painful. Referred pain is of the urinary bladder. It is felt in lower part of the anterior abdominal wall, perineum and penis. Which nerve roots will carry these referred pains? T11 to L2 and S2 to S4. Now, if we look at the arterial supply of the urinary bladder, we can clearly see that the arterial supply to the urinary bladder, it comes from the superior and inferior vesical arteries. The superior and inferior vesical arteries, these are nothing but the branches of anterior division of internal iliac artery. We know from the abdominal aorta there are two terminal branches known as right and left common iliac artery. From this right and left common iliac artery there are two subdivisions, the external and internal iliac artery. Common iliac artery, from this external iliac artery and internal iliac artery. From this external iliac artery there are two divisions are formed, the anterior division and the posterior division. And these superior and inferior vesical arteries, these are nothing but the branches of anterior division of internal iliac artery. Additional supply, it is derived from obturator inferior gluteal artery, and in females it is the additional supply is derived from the uterine and vaginal arteries instead of inferior vesical artery. Instead of inferior vesical artery, in females the additional supply to the urinary bladder, it is derived from uterine and vaginal arteries. Venous drainage. The veins draining the urinary bladder forms a complicated plexus on inferolateral surfaces. These pass backwards in the posterior ligament of bladder and drains into internal iliac vein. The veins that are draining the urinary bladder, they forms a plexus on which surfaces? Inferolateral surfaces. The right and left inferolateral surfaces, there will be the plexus which is formed by the veins draining the urinary bladder, as these veins drains into the internal iliac vein. Now, lymphatic drainage. Lymphatic drainage, the lymph from the urinary bladder, it is mostly drained by the external iliac lymph nodes, while partly it can also be drained by the internal iliac and lateral aortic lymph nodes. Mostly done by external iliac lymph nodes and partly by internal iliac and lateral aortic lymph nodes. Nerve supply. Nerve supply of the urinary bladder, it is most important part. Nerve supply of the urinary bladder, it is derived from the plexus, which is derived from the inferior hypogastric plexus. Nerve supply of the urinary bladder, it is derived from the inferior hypogastric plexus, and it contains both sympathetic and parasympathetic component. We know the sympathetic nerves, they arise from thoracolumbar region, while the parasympathetic nerves, they arise from craniosacral region. That's why the parasympathetic nerves supplying the urinary bladder, they are derived from the sacral components, that is S2, S3 and S4, and these are motor to the detrusor muscle. These are motor to the detrusor muscle. They do not supply to pre-prostatic sphincter. As I had already told in the last video that the pre-prostatic sphincter has only sympathetic supply. It does not have the parasympathetic supply. If these parasympathetic nerves are destroyed, then the normal micturition will not be possible. And the sympathetic nerve supply to the urinary bladder, it is derived from the nerve roots T11 to L2, and these are inhibitory to the detrusor muscle and motor to pre-prostatic sphincter. Parasympathetic nerves, these are motor to detrusor muscle, while the sympathetic nerves, these are motor to pre-prostatic sphincter. And one nerve, the somatic pudendal nerve, having root value S2 to S4, it supplies the urethral sphincters, which are voluntary. सो गाइज दिस इज़ ऑल अबाउट द यूरिनरी ब्लैडर। मैं आशा करता हूँ कि आप सभी को मेरी ये वाली वीडियो भी अच्छी लगी हो। तो गाइज फॉर मोर वीडियोज़ प्लीज़ लाइक शेयर एंड सब्सक्राइब माई चैनल। थैंक यू।